Hello, everyone. Welcome back to Neurospicy Nursing. Today, we're going over pediatric psychosocial conditions. Let's get on into it. All right, these are the different conditions that we are going to be going over today. ADHD, ASD, FTT. Will hit child abuse and maltreatment, the nursing interventions for those, and ACEs. One thing I want you guys to remember is psychosocial is how your brain starts to interact with the world. It's your mind meeting the world. So if you remember that, this will make a lot more sense. Okay, so ADHD. Um, Listen, I got ADHD. We're all maybe a little bit ADHD, but the most important thing about ADHD is it shows up as inattention, hyperactivity, and impulsivity. And you're typically going to see these symptoms between ages 4 and 18. So, yes, ADHD does indeed continue into adulthood. However, the diagnosis requires symptoms in more than one setting. For example, if you are only having the inattention and inability to focus in school, but not at home, then that does not count for a diagnosis of ADHD. You need these symptoms to be present at home, at school, in the daycare, and whichever. The symptoms themselves are going to fall into two different categories, which is inattention or hyperactivity and impulsivity. There is potentially a genetic component to ADHD, and there's links to certain toxins or certain trauma. Um, it's going to be diagnosed more in males. Females tend to be more underdiagnosed because our symptoms look a lot quieter. I know for myself, I didn't end up getting diagnosed with ADHD until I was about to graduate high school. So it took a really, really long time for me to get diagnosed. And that obviously affected my schoolwork. Remember that ADHD is not a behavior problem, it's a brain wiring issue. So make sure that it's not that they don't want to pay attention, it's that they're physically having a difficulty paying attention because of the way that their brain is wired. All right, so some other things, interventions, medications, whatnot we're gonna get into. The first thing that we need to do is make sure that we end up gathering a full medical and environmental history. We also have to make sure that we're modeling appropriate behaviors, using positive reinforcement, teaching coping strategies, clear boundaries need to be set. Also, reducing stimuli can help kind of calm down and quiet that brain. Also, if we help the child organize their environment, put them in group therapy and support groups so that they can see that other children around them are dealing with the same things. That can also help. Medications are used like stimulants. Um, there's also non-stimulant medications like Strattera, if you've ever heard of those. You may see norepinephrine reuptake inhibitors, and then Clonidine is another medication that's given. Another thing to remember about ADHD, the structure that is used, it's not a punishment. Yes, to the child, it's going to feel like a punishment. I know for me personally, the structured routine felt like a punishment, but it's not a punishment. It's the scaffolding to help you develop the tools that you need to become successful in life. We don't need stricter rules necessarily. What we do need is clearer rules. Simple and clear instruction that can't be misinterpreted so that we can do the things that we need to do. All right, autism spectrum disorder. Autism spectrum disorder is a neurodevelopmental condition that affects communication, social interaction. We don't know what exactly causes it, but there could be a possible genetic link. Um, Signs normally show before the age of 3. Now, as an individual who's diagnosed with autism spectrum disorder in their 20s, that is not always the case, especially for females, presents differently. Um, And again, just quieter symptoms doesn't mean that they don't have it. There is just a different, there are just different symptoms for men versus women, and that's why women get diagnosed less frequently. But signs are typically gonna show up before the age of 3. There will be limited eye contact, repetitive movements. They may have sensory differences. They'll have minimal pretend play, and there will be pretty severe distress when their routine is changed. Some interventions are going to include early screening. Early screening is so important and early diagnosis is important because, again, when you figure out that someone has autism spectrum disorder, um, it allows you to give them the tools that they need to be successful. Like myself, I got diagnosed way, way late in life. So I struggled in school for a really, really long time. The healthcare service did me, well, a disservice in that regard, where I didn't have the tools I needed and I was struggling and I wasn't successful in school. I got them before nursing school and ended up flying through nursing school like a breeze because I had the tools that I needed to be successful. So that's why early screening is super duper important, speaking from experience. Behavior modification, CBT, PT, and OT can also be helpful. Support groups, again, just knowing that you're not alone, you're not the only person dealing with this, especially as a teenager when you're really trying to find yourself, can be extremely helpful. You may end up seeing SSRIs used for anxiety, aggression, sometimes their hyperactivity and the mood swings. Occasionally, if they have severe aggression, you may see antipsychotics. Really just depends. But remember, all in all, autism isn't a lack of communication. We just speak a little bit of a different language, and that's why sometimes socially it just doesn't work. It's your parents' job, your job as a healthcare provider, to learn the language that a child is speaking to communicate with them effectively. All right, failure to thrive. Failure to thrive basically means inadequate growth. They're usually going to be below the fifth percentile or persistent weight loss. There are some causes, which include inadequate calories, like if there's feeding issues, incorrect formula, if someone is in poverty and they're adding extra water to their formula, that can also cause failure to thrive. Um, malabsorptive conditions like cystic fibrosis, celiac disease can also cause it. Crohn's disease is another one, or ulcerative colitis. Genetic conditions like Down syndrome can also cause it. If they have an increased metabolism, like hyperthyroidism, can also cause it. And then there are risk factors, including prematurity, IUGR, again, poverty, if the caregiver is extremely stressed, or if we have like severe postpartum depression, postpartum psychosis can also cause failure to thrive, or not cause, but be a risk factor for failure to thrive. And then lack of knowledge is also um, a risk factor for failure to thrive. Interventions are going to include daily weights. Remember, daily weights are better for tracking how an individual is doing over eyes and nose. They can have good eyes and nose, but if they're losing a pound a day, not good. It's the same thing like when we talk about heart failure, renal disease. We're always going to prefer daily weights over eyes and nose. We're also going to observe feedings, assess the caregiver interactions, right? Because if they're not bonding, that could be another risk factor. We're going to give high calorie formulas, make sure that we consult nutrition and lactation. Also, reducing distractions can help sometimes with feeding. And if we suspect neglect, we will be referring to DSS. All right, child abuse and maltreatment. Child maltreatment comes in four main categories: physical, sexual, emotional, and neglect. Um, The biggest thing to remember here is abuse is not always visible. However, the effects of abuse are visible. And this is why the assessment portion of that really, really matters. So, risk factors and warning signs for abuse. Risk factors can come from the caregiver, they can come from the child, it can come from the environment. Caregiver risks include young age, low income, if they're isolated from family, friends. Substance abuse can also be a caregiver risk. A history of themselves being abused as a child growing up can also be a risk factor for abuse. Or if they're being abused by their partner, that's another risk factor, a caregiver risk factor for abuse. Child risks are if you have an infant, a high needs child, like if you unfortunately have a child who has a disability, that's another risk factor for abuse. And then premature infants is also a risk factor for abuse just because there can be bonding issues there. Warning signs can be very vague explanations of what had happened to the child, as well as if they delayed in seeking treatment, if they have lots of school absences, if they already have had failure to thrive or currently have failure to thrive. Poor hygiene is another one. Fear, aggression, regression, UTIs, STIs, personality changes, enuresis. Those are all warning signs for um, abuse. Environmental risks I forgot to go over, which was stress, divorce, unemployment, substance abuse, and poor housing. So, the biggest thing with abuse warning signs and risk factors is kids are not going to lie about the amount of pain that they're in. They're not going to lie that they have pain. And when we see that the story that the parents are telling is not matching the injury, we're going to listen to the injury and we're going to separate and get the story because the child is not going to lie about what happened. Now, they may have a different interpretation of what happened to them. If you guys like to watch those true crime videos, um, there are some children who will make up a scenario because that's how they interpreted what happened. Like, for example, there was a mother who stabbed her child and she took it as someone bit her because that was her understanding of what happened. She got bit really, really bad. She had gotten stabbed, but she had gotten bit by a big cat in her head, but she was only a toddler, so that was her understanding of what happened. She doesn't understand that her mom took a knife and plunged it into her chest. You know what I mean? So there may also be stories like that, but because they're so young, you kind of have to put the pieces together and figure out what they're saying. It can be very difficult and it's very emotionally challenging when you're dealing with stuff like this, but just make sure we're listening to the injury and children aren't going to lie about what happened. Okay, so diagnosis and interventions. So again, we're listening to the injury, different interpretation because their mind is going to protect them, right? So they may have a different interpretation of what's going on, but that doesn't mean that they don't still kind of have an understanding of what's going on. Their mind is just right now creating a scenario to protect them, to keep them safe. All right, so diagnosis are going to include labs, STI testing, UAs. We're going to do some imaging as well, and we're documenting the facts. We're measuring bruises. We're completing a neuro assessment. We're measuring any scratches. If we're looking at breaks, and if there are various signs of healing, we're documenting that they have breaks in various stages of healing. We're following the chain of command. We're following the photo photography policy. We're using open-ended questions. We don't want just a yes or a no. We want them to be able to explain what happened to them. And we're providing safety and resources for the child. We're documenting this like it is going to be used in court because it might very well be, and good chances that it will be. So you are documenting all of the facts and not putting your opinion in it. And if they say something, you are putting it in quotations and you're documenting it. Also, the charting that you do is going to protect the child and it's also going to protect you. All right, so adverse childhood experiences. ACEs can include neglect, violence, witnessing violence, racism, bullying, poverty, lack of basic needs, and all of these different things create toxic stress, which can affect your cardiovascular system. We've talked about how that sympathetic nervous system can increase your blood pressure, increase your heart rate. Well, if you're under constant stress, constant fight or flight, the same thing can happen. This individual can end up with hypertension in the future because of that chronic toxic stress. They also can have GI issues, immune issues, and brain development issues. There's also a way to counter ACEs, which includes support system, coping skills, trauma-informed care, and then prevention is always going to start with screening and early interventions. ACEs can stack up, okay, but the support system helps kind of take that weight off, and that's really what's most important about being a nurse is helping take that weight off of that child. Okay, these are the resources. By the way, um, copy and pasting my resources. I have like a whole Google Doc of them. I didn't realize that I was still putting the mother baby one in, so I have now fixed that. It is the RN pediatric nursing one that I've been using for the pediatric slides. Minus if it was like newborn slash infants, that one did come from mother baby, but we have transitioned into this one now. And that's all. Thank you guys so much and have a great day. I'll see you in the next one. Bye.